How you doing, folks? This is Tony the Mayor from my Experience, Strength, and Hope podcast. And I just want to do just a short video because my last video I talked about, the prostate cancer, my cancer, not say my cancer, the cancer returning. And I'm currently going through a hormonal therapy, injections, and started my first appointment with radiation 2 or 3 days ago, and the regular radiation will start regular sessions, and probably next week or somewhere towards the end of next week or week after, which will be 35 sessions of radiation. And I had my prostate removed, and it resurfaced. Now they're doing other tests, CT scans, PET scans, just because of the prostate bed to where they're going to treat for radiation and see if that's what they should do. Also, as far as digging deeper into some other things that were taking place down there, which I can't even hardly pronounce some of the things. I know they're have to do with lesions or some type of growth lesion or something on your bone. So we're praying for that too. But I just want to fill you in on a little of what's taking place with me and keep you informed and knowing that I'm still going to be doing my podcast and everything. So I'm still doing that. But I wanted to shift. I was talking to a friend the other day and wanted to shift to let people know, kind of my journey on this. Now I'm going to it more. It started back in 2021. I had a completely prostate removed, and I think it was later that year in December, and PSA started to rise back up, indicating that it was still signs of cancer cells growing. And I tell you, some of the stuff I've been going through, people really don't understand. But if anyone out there has ever went through taking the Lupron or the Eligard shots, then they know. Go back there, and where everyone else is receiving chemotherapy, sitting in a recliner, they make you feel so comfortable, but it's a different type of feeling. The feeling that is more emotional than physical, and then the physical things kick in about 2 weeks. But I also want to talk to you soon, maybe later today, about, just some of the effects that it has on me and some of the things that it does to you that you have to deal with that nobody tells you about. I keep going back to the person when I first saw him, I had prostate cancer. Oh, that's the easy cancer. There's no such thing. You don't know where you're going to end up and how long in your life you're going to have to deal with this. So keep me in prayer, and remember, I'm going to stay strong. I still believe and know that I can do this, even though sometimes I am seriously down. Sometimes I had more bad days than good days sometimes, but I have to try to make my good days outweigh my bad days now. And it's anybody can tell you, just believe in God, trust God, just cheer yourself up until they're in that position. And not just physically, I'm talking about a lot of the other things that you think about that's happening and dealing with everything. And I'm going to go into that first, managing so much and the carriers out there, even when you have good insurance. The care that's out there and what's provided to you and what's not provided to you or offered to you. Keep me in prayer. I'm Tony the Mayor. Peace.